Implant overdentures with a Dentka system. Without question, implants and implant overdentures have changed the practice of dentistry. Now, clinicians can fabricate implant overdentures following the Dentka protocol. If the patient already has implants with attachments, the procedure is very similar. Begin the process by following the steps you would for a complete Dentka denture. When taking the impression of the arch or arches that have implants, take the impression directly over the abutments or housings. Continue following the standard sequence for capturing records as with complete Dentka dentures. Send the impressions and bite registration, which Dentka will use to design the dentures, with relief provided over the abutments. The clinician can proceed with try-in or final. Both will be relieved with space for the abutments as determined in the design. If the patient is edentulous and going to have implants placed, a 3D printed surgical guide can be fabricated along with the Dentka try-in and final dentures. This provides the option to immediately load at the time of implant placement if the clinician determines that the patient is a candidate. As previously determined, follow standard Dentka procedures through the optional try-in and final denture. Once satisfied with the try-in denture and final denture, a clear duplicate can be printed that will serve as a surgical guide. Identify on the clear duplicate where you would like your implants placed and open that area with an acrylic burr. Since the duplicate fits identically to the final denture, it is stable and predictable as a surgical guide. This allows the surgeon to place the implants in an ideal position for denture forces. Now the attachments can be picked up. First, seat the housings on the attachments, then apply blockout material. Depending on the height and inclination of the implants, one can use rubber dam pieces, light cured blockout resin, the rubber rings that come with the attachment system, or any combination of the above. This helps prevent the denture from locking around the implants when you apply your acrylic. If this is done on the day of the surgery, make sure any sutures are protected with dry foil or a rubber dam. Next, relieve around the attachments and housings. This can be achieved with any pressure indicating medium to show where the housings are interfering with the denture seat. Apply the pressure indicator to the intaglio surface of the denture and attempt to seat over the blocked out housings. Once the material has set up, identify any area of interference and adjust with an acrylic burr in a slow-speed handpiece until the denture can be fully seated. It is critical to relieve until the denture is fully seated, as soft tissue support is necessary for an even distribution of forces and long-term denture success. One can also open vents on the lingual to allow excess acrylic to escape. Sandblast or roughen your housings to improve retention. At this point, the acrylic can be mixed and the denture seated. Making sure the denture is fully seated, allow the material to set per the manufacturer's instructions. Polish any excess acrylic and change the attachment to the desired retention. The overdenture is now ready for delivery. As an alternative, impression copings may be placed on the abutments and the impression taken over them. In this situation, the final Dentka denture will be returned with the housings in place, ready for delivery, with no need for chairside pickup. Follow up with a Dentka overdenture patient as with a conventional overdenture patient.